Hi, I'm Brett, and today I'm going to be presenting on the effects of MDMA-assisted psychotherapy on personality changes in people with post-traumatic stress disorder that have symptoms that are resistant to treatment. So, post-traumatic stress disorder is caused by an extreme stressor, though it doesn't mean everyone who experiences an extreme stressor will develop PTSD. PTSD actually affects 8 to 10% of the general population, and everyone in their life will experience some form of trauma. So it's really important that we have a treatment that addresses this issue. Personality changes in PTSD are caused by a loss of sense of control and a loss of sense of identity. MDMA is a drug that's hypothesized to help with this. So in the 1960s and 70s, a lot of recreationally, MDMA was used to cause prosocial effects and benefits between people. MDMA works by calming the amygdala, which is in charge of the fear response, and allows people on MDMA to experience trauma and remember their trauma without being hijacked by their feelings and taken over. This works through mechanisms of neurotransmitters and hormones. Neurotransmitters such as serotonin, which causes feelings of happiness and content, and oxytocin, which is a hormone that's released when women breastfeed or give birth, and it causes bonding feelings and feelings of love. So the methods for this study were, they had to make sure that people in this study did not have underlying personality disorders. So they screened for bipolar personality disorder and other underlying personality disorders that weren't caused by their PTSD, such as depression and anxiety. They also had to make sure that people had CAPS scores of over 50. A CAPS score is the clinically approved PTSD severity score. The closer to 100, the more severe your PTSD is. They also had to make sure that people were treatment resistant. So they had tried SSRIs, which are depression medications, for over 3 months without any benefit, and SNRIs for over 6 months without any benefit. They also, for the personality measure, they used the NEO Personality Index. So which consists of 240 personality measures separated into 5 main groupings, which is called the Big 5 Factor Model. They focus mostly on neuroticism, which is like intense anxiety or fear or prone to anger, and openness, which is openness to experience and imagination and creativity. And an independent rater looked at the transcripts from the therapy and actually assessed their personality score and their CAPS score. So the design of this method is that 20 people were chosen, 17 female and 3 males, all Caucasian of about 40 years of age, and they had 2 introductory sessions with their therapists, and then 2 either MDMA-assisted trials or 2 psychotherapy trials with a placebo. 12 people were put randomly in the MDMA trial, and 8 were put into the placebo trial. So after each of the experiment conditions, everyone was given 4 additional therapy sessions. And then after the conclusion of the study, 2 months later, all 20 people were invited back and told who was given MDMA or not, and given more CAPS and personality tests after they were told, before they were told whether they were given MDMA or not. So the therapeutic intervention was there was a male psychiatrist and a female psychiatrist in both psychotherapy present. One was a psychiatrist and one was a psychiatric nurse. The sessions lasted about 6 to 8 hours, and even though they were blind for the 2 months, they were told after the 2 months, all the patients were told whether they were given MDMA or not, and then given the option if they would like to have a 3rd trial of MDMA-assisted psychotherapy, and the placebo group was given the choice if they wanted their first session of MDMA-assisted psychotherapy. So here are the results from the first part of the trial. So they looked at the baseline before any therapy, their CAPS scores and their personality scores. So this first graph used openness as a covariate, and you can see that in both the placebo-assisted psychotherapy and the MDMA psychotherapy, their CAPS scores decreased. So their symptoms of PTSD decreased and got better. And same with neuroticism. So it was how they're decreasing eroticism and they're increasing openness. So here in the second part of the trial, they wanted to look if these personality changes were permanent. So they looked at 45 months after the 2-month follow-up to see if these personality changes were consistent. And they found that in the long term, they were. So you can see that neuroticism at the baseline was still decreased 45 months later, and that openness was still increased 45 months later. So the results were that MDMA-assisted psychotherapy is the best treatment, better than the other psychotherapy, but both psychotherapies helped decrease symptoms in PTSD and help increase positive changes in personality. So some limitations of the study were the small sample size of 20 people participating in the initial trial and 16 people coming back for the long-term follow-up. The second limitation of the study was that the independent rater who looks at the CAP scores and PTSD and personality scores was subjective and used their own experience to judge these people's scores of PTSD and personality. And then a third limitation was that even though the trial was double-blind and people didn't know whether they were getting MDMA or the placebo, they could usually tell whether they were on a hallucinogenic or not. So for future research, I think we can look into epigenetic changes caused by trauma, which are how tightly genes are methylated and whether they're expressed or not, and the effects of MDMA on epigenetic changes. And then I also think that future research should include other drugs that can have better effects other than MDMA, because MDMA does have can have negative cardiovascular side effects, and other diseases that could benefit from MDMA. Thank you.
How'd you feel?
Oh my god, it was like 11 minutes every time I